Hafide, I'm Adriana Cotero. It's been over a month since we've been ordered to stay home, and with hardly any new viruses reported, there's talks of a recovery plan. In this week's TrendSpotting report. Thank you for tuning in to TrendSpotting. Here are the stories that grabbed your attention. If the Guam Chamber of Commerce had it its way, you'd begin to see some businesses reopen as early as next week. A proposal by the organization made up of local businesses recommends opening certain services that with the gradual rollout would get the island opened up in about 2 months. All would require some of the protocols we continue to use today, including social distancing and sanitation protocols. For example, services that require close contact, including barbers, salons, gyms, and realtors, would require appointments. Shopping centers and malls would limit the number of customers inside at one time. The Chamber's proposal further states that by May 4th, all government offices and private sector businesses would open, with the exception of bars and sit-down service at restaurants. By the week of May 25th, all parks, restaurants, and gathering places would open up, and by June 22nd, just about everything resumes to normal operations. We asked you if you were for or against this aggressive reopening plan. Here's how you felt on the matter. Finally, the Chamber also said the airport should start body temperature scanning, pre-boarding health surveys, and footpad sterilization for all arriving passengers. Now that's just a proposal from the Chamber. When it comes to the data that will help get us into recovery mode, Dr. Felix Cabrera shared some good news. He's part of the Governor's Physicians Advisory Group, which detailed a revised trajectory for the island's hospital capacity. So far, he says, mitigation efforts are working because we've helped flatten the curve significantly. The data shows that mitigation efforts are followed 2 weeks later by a decline of reported virus cases. Cabrera said, quote, "And we are successful in suppressing a major surge because of everyone's actions and because of the leadership of our governor. It's important we recognize this achievement, but the reality is that we still have a lot of work to do," unquote. This week yielded positive COVID-19 test results in the 0 to 1 range day after day. The low numbers, however, also reflect the extremely low number of people being tested for the disease. The governor said it's because there aren't as many people with symptoms availing themselves at clinics or the hospital to be tested. While seeing 0 to low numbers, Guam Memorial Hospital Administrator Lillian Posadas shared some more incredible news during one of the press briefings. Earlier this week, there were no COVID-19 patients in the public hospital's intensive care unit. And back to testing. The island is ramping up efforts to identify cases of COVID-19 on Guam, with the expansion of testing. Before, testing was limited to priority grouping, barring those who suspected they might have the virus from getting tested. Now you are encouraged to get tested in a clinic if you have symptoms that could be COVID-19 related. That includes fever, a cough, shortness of breath, a sore throat, diarrhea, loss of taste and smell. If you are a healthcare worker, first responder, or someone who cares for others in vulnerable populations, especially with any symptoms, you are also urged to get tested. With more equipment and materials, the government hopes to begin testing up to 250 people per day. Public Health this week also began its pilot program in Estembo Dededo, looking for pockets of infections inside certain communities. The ramped up testing is a big part of the next step to begin considering the island's road to recovery. Thank you for staying with KUAM on all our social media platforms. I'm Adriana Cotero for TrendSpotting. Be safe.